Welcome to the Podiatry Profits Podcast, where you will discover how to get more patients and multiply the profits of your practice with minimally invasive foot surgery, proven marketing systems, and ethical influencing to your patients. And now, your host, board-certified podiatrist, best-selling author, speaker, and founder of TJ On Coaching and Consulting, Dr. TJ On.
Hello, podcast listeners. This is Dr. TJ On. In this episode, I want to focus on minimally invasive foot surgery. As you know, I perform minimally invasive surgery. I used to perform traditional open surgery. That's pretty much what I have been learned at the surgical residency. And I've been, obviously, like most of you foot surgeons out there, I've been performing traditional open, but, I wasn't really happy for several reasons. No matter what you do, a lot of times you have to definitely open up like with a wide, large incision and dissect it out into the bone, causing, some unintentional soft tissue injury that usually creates more edema and, post-operative pain, and also a lot of traditional open surgeries, most surgeons use a tourniquet at the ankle level or calf level that can cause DVT and etc., unwanted complication. And also traditional open surgery, most procedures require some sort of hardware fixation that it is more difficult to perform at the office-based surgical suite. So for me, about between 2012 and 14, I was about to quit podiatry because of, again, Obamacare and, dwindling, ever decreasing reimbursement by most insurance companies. But then I found out the minimally invasive surgery around that time. So that's how I got involved, because from about to quitting podiatry and venturing into new career, minimally invasive surgery, the first time I saw, I felt like something hit my head, like lightning or epiphany. Since then, I didn't look back. At the moment, I immediately took action. Some of you already know I'm an immigrant from South Korea, so I already had that character, that trait in me about survival. And, natural curiosity driven, I wanted to learn as fast as I can with the proper techniques. So I had to spend so much money, time, energy, time off of work, learning from my mentors in 2014. Many travel to the mentors and implementing, MIS to my patients. Obviously, it completely transformed. Otherwise, I wouldn't be here creating, podcasts and helping other doctors, right? So fast forward, past 3 years or so, I have been advocate of minimally invasive surgery. Why? It liberates you. It can liberate you in many ways. This will enable you to transform your practice from hospital-based, surgery center-based to office-based surgery. So much easier. And also you can provide great alternative treatment solutions to your patients, which will not only help them heal, fast and without big scar, and a lot of times without the need for internal metal fixation. The patients will save so much money out of pocket cost because of the fact that they don't have to pay facility fee portion to hospital or surgery center. So it gives you that marketing edge, competitive edge. For patient benefit, it's amazing. For surgeons' benefit, it's equally amazing because once you start implementing minimally invasive surgery at the office setup, you will get reimbursed more even if you choose to continue to participate in insurance network. I recently got a letter from Blue Cross Blue Shield of Illinois officially stating that they will reimburse 15% more if you perform procedures in your office. And equally, you will get 15% decrease if you perform same procedure at the hospital setup. So what does that tell you? Insurance companies and governments, they're promoting and pushing toward the office-based surgery. Okay? You see why your surgical numbers are down? It's two reasons. Surgeons don't get enough reimbursement, so it discourages surgeons. And also, patient out-of-pocket cost and risk of going to big hospital, etc., that scares patients. So two reasons why it's natural that your surgeon numbers are down. But myself and all the doctors that I'm helping with minimally invasive surgery, their surgery numbers are way higher now. Typically 3 to 5 cases a week is not uncommon. So anyways, I can speak hours about the benefits of minimally invasive surgery and how it can positively influence your practice in terms of finance and your lifestyle. So I want to tell you what are the best steps to moving forward with minimally invasive surgery. So most doctors ask me, okay, TJ, I see the potential benefit of incorporating minimally invasive surgery. So how do I go by doing that? Well, I'm going to just tell you the most important things. You need hands-on experience. You need cadaver lab. Okay, you can learn theories and steps and stuff like that, lectures, but if you don't get on hands-on practice, it's very difficult to incorporate because of the fact that most minimally invasive procedures are done without relying on your vision. Typical to traditional open surgery, you dissect everything to see everything. But minimally invasive surgery, you have to rely on your hands, your fingertips, so other sensations that you're not used to, auditory sensation, vibratory sensation, tactile sensations, etc. Those really can be improved greatly with hands-on cadaver lab experience. I offer private group cadaver lab to doctors that I'm helping with as a private membership. So you can reach out to me if you want to accelerate. Well, if you are still not, convinced, then you can come to like annual, type of cadaver lab, which are open to typically public, right? So I do have annual cadaver lab that I have hosted and organized successfully, all sold out past 3 years, except 2020 because of COVID, I had to cancel it. So if you're interested in listening to this podcast and you haven't still implemented, but you want to see what it's about, but you don't want to commit to my accelerator program, that's fine. You are welcome to register and sign up for my annual International MIFAS Cadaver Lab workshop. It's gonna be held in Rosemont, Illinois, at Orthopedic Learning Center. Most of you practice in the United States know Orthopedic Learning Center, or OLC Conference Center in Rosemont, Illinois. It's Chicago, basically, right by the O'Hare Airport. So this year it's set up for July 16th and 17th. Again, July 16th 17 is 2-day intensive cadaver lab workshop. First day, July 16th, it will be all lectures, didactics and lectures. You will learn, core foundations to advanced lecture and complication lecture, and we'll provide beautiful dinner and stuff on Friday night for everybody, every attendee. And Saturday all day we'll be doing cadaver lab. You will have a chance to sign up for your own cadaver lab experience. That means you're not going to share. You will be able to practice a lot on your own assigned cadaver lab. And we'll have amazing lineup of minimally invasive surgeons all around the world, podiatrists and orthopedic surgeons. It's going to be fun. It's very high-end, premium level, limited number to 50. Because of COVID reasons, it will be limited to only 50 attendees. And normally it sells out as soon as I put the marketing messages out and sign up pages. It normally sells out within 30 days. So if that's something you like, please let me know. You can send me an email, tjan@drtjan.com, or you can text me. I gave you that number. You'll hear that again at the end of this podcast. It's 312-847-3180. 312-847-3180. You can text me like any questions, or if you just want to connect with me, say hello, and then you'll start getting updates about upcoming events and stuff for free. Well, you have to pay for the event. What I'm saying is, all the promotional stuff and also quotes and I will provide a lot of good resources for free though. Some wireframe work of, some protocols related to minimally invasive surgery or business side. So you'll get a lot of benefit out of that, connecting with me on my phone. Again, 312-847-3180. Okay, so first one is that cadaver lab hands-on experience is very important. Second most important thing in my experience, that past 3 years of teaching other doctors and myself implementing since 2014, you need a great mentorship. You need a mentorship and a support group. You know why? Because minimally invasive surgery, it's scary. It takes a huge leap of faith, especially if you're coming from traditional open surgery background. So you need a support, accountability partners, support group, and great mentorship who's done it before you, who has made already mistakes and trials and errors, so you don't have to repeat those on yourself. Trust me, if you start implementing minimally invasive surgery on your own patients, you'll have occasionally, hopefully very few, sleepless night. You know what I'm talking about. So imagine if you're doing this all by yourself. It's going to be tough. It'll affect your daily schedule, affect your family, affect your colleagues around you, staff. Contrary, if you have a mentor that you can trust, who really has done it and practicing what they preach, and if you have a group that will support you positively, that makes a huge difference. And, I can assure you this will accelerate your implementing minimally invasive surgery on your practice at your office-based surgery suite so much faster and safely and properly. Okay, so to summarize, most important factors in order to implement MIS. Cadaver lab hands-on experience, number one. Number 2, have mentorship. Number 3, have support group. So those 3 factors alone, it will triple to 5 times accelerate your implementing minimally invasive surgery. I assure you, and I'm 100% confident, I'm telling you the true statement, seeing many doctors going through with mentorship program and without. To be honest, most of doctors I've talked to who are going without it, to be honest with you, they haven't even implemented yet. Okay, most of them don't even implement because of a lot of factors: procrastination, fear, anxiety. So, but I'm just telling you again, current healthcare change. Okay, it's a different era that we are at, especially post-pandemic. We are at different stage. The whole world is going through a hard reset in many aspects, financially, politically, you know what I'm talking about. And healthcare change is no exception. It just added headaches and added difficulty what's coming up ahead. So, you might be listening to this podcast episode maybe by accident, but I don't believe in by accident. I believe you're listening to this episode for a reason. It's happening for a reason. And, I want you to kind of think about your own practice, current state of your finance, your lifestyle. And I can tell you, I've been helping many colleagues to get out of this rat race or mousetrap. Okay, so there is a hope. I have so many proofs that I've helped so many doctors. Again, if you want to step ahead of the game and jump into this new wave of minimally invasive surgery and office-based surgery, or you want to build your profitable private practice, even non-surgical, I've been helping other doctors through podiatry profit sales system, which is called the Profit Alchemy. So again, there are resources and there are mentorship available for you. It's just you who need to make decision and take action. Again, making decision only, that doesn't change. Having ideas, that doesn't change. Only things happen when you take action. Ideation doesn't mean anything. You have to put it into reality by executing them and implementing them. Hopefully, this episode helps you to encourage your future of podiatry is still bright if you realize this reality and implement it right away. Thank you so much for listening to this episode. If you liked my episode, please subscribe and also give me some reviews that will boost, the visibility of my podcast to other colleagues just like you. Let's help each other. Enough negativity in this world. I want to create positivity with you. I want to create beautiful, supportive community with you. Sounds good. And, be healthy. And I want to, encourage you to take action right away. And I'll see you in the next episode. Thank you. Hey everyone, this is Dr. TJ An. I just opened up a texting community for medical professionals like you, which means you can text your questions. Right now, I'm spending anywhere between 15 to 30 minutes every single day through these text messages, answering questions directly to people in my community. So it's really quick and simple. I want you to stop everything you're doing right now and pull your phone out and actually text me a message. The phone number you text is 312-847-3180. Once again, it's 312-847-3180. When you text me, just type hello, and what's going to happen is that you'll get a reply from me right away to add me to your phone contacts, and I add you to my phone, then we can start having conversations. On top of that, through this texting community, I give you free resources, free copy of my book, and any exciting upcoming events, live or virtual, and whole a lot more. Also, I send you some of my favorite quotes, medical business frameworks, strategies, and tactics you get for free only through my texting platform. So what you need to do right now is to pull out your phone and text me hello at area code 312-847-3180. One more time is 312-847-3180. I am so looking forward to hearing from you right now.
You've been listening to the Podiatry Profits Podcast with Dr. TJ Ahn. To find out more about Dr. TJ Ahn or discover how you can grow your podiatry practice, visit drtjahn.com. Or you can also get a free copy of Dr. Ahn's best-selling book, Opt Out: How to Take Back Financial Control of Your Private Clinical Practice Without the Hassle of Insurance Companies. Just go to optoutbook.com.